Take you to Sunyani in the Bono region, where there's a rise in substance abuse amongst the youth. When we were in SHS, we thought that substance abuse is a wrong thing. We shouldn't get involved in drug peddling and all of that. But we are in 2025, and somewhere in the Bono region, in Sunyani, the youth of the community are abusing substance. They are. A couple of years ago, we saw stories on television, online, and news portals where there was such a concern here in Accra, some parts like Circle and the likes. But it has traveled to the Bono region. It's very, very alarming. Because again, these are the youth. These are the people to step into shoes to lead the country, and we are losing them.
Well, I mean, the question is, why are people abusing substance? Is it because it's available? Is that the reason, or there's something else? What are they looking to escape from? You know, that makes people want to abuse substance. I think that we should look at the report by Michael Mfum, you know, and then when we come back, we can delve into the issues and hopefully also speak to Michael as well a bit further. Let's take a look at this report.
Substance abuse remains a pressing concern in Ghana, with research indicating a troubling rise in drug use among young people. A study published in the African Journal of Educational Studies in Mathematics and Sciences highlights marijuana as the most commonly abused substance, with some children as young as 10 to 12 years being introduced to it. In Sunyani Zongo, a densely populated community in the Bono region, the situation is not different.
Islam frowns on these characters. Islam's talk against this whole thing about abuse. And we as imams, every now and then, have tried to preach against it. At first, all the MCs who have come and gone could testify to our seriousness with regards to this canker, because the Deputy Regional Chief Imam himself led this. We met the then MC. That's as a result of why the place is cleared now.
Residents of Sunyani Zongo have also voiced their concerns about the growing menace.
In fact, I cannot tell you the number of young, innocent individuals who are involved in drug peddling and substance abuse in the Zongo community. And one facility that is aiding and facilitating drug peddling in the Zongo community as we speak right now has to do with what we call the boiler down.
Our youth are spoiling because just where they are taking the distance, the weed and the cocaine are just within a Zongo area, you know. So for that, they have taken their advantages and are convincing our children.
Tensions recently escalated when a confrontation erupted between local youth and drug peddlers operating in the area. Addressing the issue, Abdul Ikad Issa, assembly member for the Sunyani Zongo electoral area, spoke on the ongoing substance abuse problem and the recent clash between the youth and drug peddlers.
How long are we going to sit there for some of these things to continue? So the leadership of the concerned youth of Sunyani Zongo went to the boiler down where some of these activities are taking place. We met the leadership there. You know, when you go there, those selling the drugs and using, they also have their leadership. We went there, we tried to use dialogue to solve this issue. We cannot end the use and sale of drugs, but what we are saying is that the place is so open, and then most of the children go into school. That's the road that they use. And you know, most of them have become addicts due to the proximity of the area to the community. So we were simply telling them to get a new place. I know all of them came from their houses. If you decide to do it at your house, that's your own cup of tea. So we met them and gave them an ultimatum. And before the ultimatum, we heard that these people have organized themselves. Their leadership has gotten them machetes and other weapons to attack any Zongo youth who try to evict them. We don't have the authority to evict them, but we're just trying to explain to them the situation, how the community, they are spoiling our children.
He further called on security agencies to adopt a more strategic approach in tackling drug peddling.
We know it is the work of the security agencies. Once we've sent our petition to the regional police commander, the divisional police commander, the commanding officer of 3BN, we've copied Sunyani Traditional Council, we've copied National Youth Authority for all these institutions to come together so that we can find a lasting solution to these activities of illicit drug sales and consumption at Sunyani Zongo.
Wow, that's rather a sad report there for me. And I don't know how you at home feel about it, but you can send us your thoughts and comments as well on the WhatsApp number on your screen. And that report was filed by our Bono regional correspondent, Michael Sapon Nfum. But joining us on the phone is a clinical psychologist with the Ghana Psychological Association. She's joining us via Zoom, Ophelia Boma Azuri. Ophelia, good morning.
Hi, good morning.
Thank you so much for joining us on Breakfast Daily.
Thank you so much for inviting me. It's always an opportunity to serve Ghanaian citizens.
All right, thank you. And let me start off by asking you, from where you sit as a clinical psychologist, what do you think are some of the psychological or social factors that are leading to the rise in substance abuse?
Yeah, for the case of Sunyani, it is number one, an early exposure to substance use, or the addiction of certain substances like marijuana, cannabis, and alcohol, and all of that.
Right, so we are having a bit of a technical challenge, but we'll try and reconnect the phone lines or the Zoom and then get talking with Ophelia to get more perspective into this issue. Kweku,
yeah.
So you saw the report. What do you make of it?
Well, I think that we need to understand, first of all, what are the factors that cause this, right? This is not unique to Ghana. Okay, it's not unique to the Bono region, right? I think Ophelia is back on the line.
Right. Ophelia, welcome back.
Yeah, thank you.
We're having a bit of a challenge with the network this morning, so we apologize for that. But yes, you were speaking to us about what is causing that the substance abuse in Sunyani. So you can go ahead.
Okay, yeah. So targeting Sunyani community on its own, I realized that there has been early exposure to some of these substance use disorders. Number one, for the fact that Sunyani is a more culturally infined community, alcohol is being shared through their social gatherings like funerals, parties, and all of that. So a lot of times adolescents are early exposed to some of these alcohol and then cannabis and cigarettes or weed and all of that. Number two is easy accessibility. Because a lot of times, some of these illicit drugs are affordable, as low as 2 Ghana cedis and 5 Ghana cedis. So they don't really need to have so much money in order to afford illicit drugs. And number three, for Sunyani, I have lived in Sunyani before, and I know the Sunyani Zongo, and I understand the cultural heritage and also the demographic definition also. I understand that Sunyani per se has low attendance to mental health services. I remember the time I was there, in the regional hospital, there was only one psychologist that was available. So you can also understand that there is the gap of mental health accessibility or mental health awareness and campaign to help these youths that are already involved in substance use disorder, to counsel them or even rehabilitate them. So at the end of the day, we are looking at the gap of mental health services and awareness in Sunyani community, and early exposure, and also the accessibility of drugs in Sunyani community.
But why do we have a challenge of not having adequate mental health facilities in Sunyani to deal or to tackle some of these issues? Well,
there are so many factors, but I would mention 2 or 3. number one, already in Ghana, we have very few professionals, mental health professionals available. And a lot of these professionals are disposed in the urban areas like Accra, Kumasi, and all of that. But going down to the northern areas of Ghana, there are normally one or two. And number three is the acceptability and awareness of mental health. Okay, so in Ghana, mental health is still growing. A lot of people are yet to come to understand the terms of mental health, what it means, how to really integrate themselves and navigate their own mental health. And because of that, people will not really like to be related or being associated because of the stigma as well in coming from mental health services. And lastly, I would say because of cultural factors, traditional and faith-based healing processes. A lot of people would rather go and see pastors, herbal treatment and all of that than actually go see a mental health psychologist because of the understanding towards mental health. So there's always been an awareness and advocacy by the Mental Health Authority to educate people about mental health and also to advocate for more professionals to join the Ghana Psychological Association and Ghana Psychology Council, as well as posting staff to these areas. So at the end of the day, we are looking at how many people are actually aware of the mental health profession and are they willing to go into these communities to stay there, to advocate, to treat, and to prevent all of these mental health challenges. So this is one of the reasons why Sunyani do not have a lot of mental health psychologists available.
Right. Again, from where you sit as a clinical psychologist and the fact that you mentioned that you've lived in Sunyani before, are you able to tell us what could be some of the causes that lead to the youth peddling drugs and involving in some of these activities? What could be the cause? What's the problem?
Okay, so number one could be unemployment. All right. And if people are faced with unemployment, they are also faced with chronic stress, depression, anxiety about their life, and they may also use drugs as a means of coping. So in our Ghanaian setting, we know that a lot of people use alcohol to cope, cope with grieving, cope with heartbreak, cope with disappointments, and so forth and so forth. So at the end of the day, when youth are exposed to this wrongful way of coping, they end up becoming addicts. Secondly, peer pressure and the environment on its own. So if a teenager is grown in an environment just like the Sunyani Zongo, whereby the friends are also using in order to fit in because of social conformity, the youth may like to also try to fit in. And I know of few people who have tried alcohol and drugs and all of that just because they want to be like their peers. Number three, I will talk of social isolation in an area where people feel alone. As you know, there's a growing pandemic of loneliness, and a lot of times they may be parent present, but a lot of these there may be parents alive, but a lot of these parents are absent in the life of their children. So there is lack of guidance, and they may not even see the signs as when their adolescents are using. So these children are left unattended to, and they start using drugs by whatever means. Fourth, I would also like to talk about, again, genetic predisposition, whereby if there is history of a certain family using drugs, there could be the inherited genetic factor on the adolescent. So that is why a lot of times mothers are advised not to use drugs or alcohol during pregnancy, because at the end of the day, a child being born by an addicted mother is highly possible, susceptible to becoming an addict as well. So these are the few factors to why a lot of youths are engaged in alcohol or substance use disorder. Lastly, streetism. Okay, here in Accra, we know that there are a lot of people, there are a lot of teenagers on the streets that have parents alive, but they still find themselves on the streets. And I have also worked with street children before, and substance use disorder is highly found in these. It's highly inevitable in people living on the streets. So at the end of the day, they use it to cope. Why? Because of depression, because of anxiety, because of lack of purpose, because they do not really know themselves, and they are lost in identity crisis. A lot of them will just become addicts to cope with their life. And because of disappointment too, when they look at themselves and they look at their colleagues who are doing well and they are not doing well, they just want to use the substance in order to cope with the trauma or the pain as well. Yeah.
All right. Can you sort of give us a sense of, first of all, the drug of choice that is the one that's most popular, because I know some countries they have challenges with people sniffing glue and all of that. I'm not sure if that's a big deal in Ghana, but what's the typical drug of choice that the people are using now, and what would you propose should be our first steps to actually solving the problem?
Okay, thank you. So for number one, it's cigarette. Cigarette is 26.4% used in Ghanaian communities. Number two is marijuana, which is also 16.2%, which is weed. And the others like alcohol stands at 56.9%. However, the other illicit drugs are not being recorded, so lack of data may not really expose the other illicit drugs, but there are opioids, there is cannabis, and there is tramadol, and a whole lot out there. However, Ghana is ranked as one of the leading highest consumption rates using illicit drugs in Africa. So right now, this is where Ghana stands. Yes. So it's ranked as one of the highest consumers of illicit drugs in Africa currently, which means it is a public health pandemic. So I would like that the government, just like when COVID-19 hit Ghana, we were really putting all our advocacy, our money, health professionals, and the use of the media to actually advocate for this. I would like that the government will also treat this as a mental health pandemic and a public health pandemic, in coming in, number one, with public awareness. Number two, with what we call the harm reduction services, because a lot of these drug addicts share needles and share all kinds of stuff that would increase STDs amongst them. The harm reduction services is more of an approach that would welcome drug addicts and provide them safe needles, guide them and attend to them, just like OPD services. This is not to increase the use of addiction, but rather to reduce harm, to reduce risks, and the transfer of STDs like HIV, because we know in the addiction community, HIV is very prevalent amongst them. So in order to reduce this, the government has to come in with the harm reduction services. Also with mental health awareness and campaigns. I know in Ghana, this is sad to say, but the government is not really supporting the mental health authority and the mental health services in Ghana. So because of that, people are not aware and people reject mental health services. But if the government should push all efforts, finances, and funding into us really reaching into the indigenous communities, like far back, like Daru, Boku, and the Warages, Nandoli, and all of those areas, it means that we are providing health coverage at large. And at the end of the day, every single person, whether in urban areas or rural areas, will come to terms to understanding and accepting mental health. Instead of grieving healthily, they would not use alcohol to grieve. And I would also like that the government would ban the use of alcohol at funeral gatherings. As a mental health psychologist, it is sad as a mental health psychologist, it is sad, and I understand that people use alcohol at funeral gatherings to cope, which is very wrong. So the government must ban alcohol use at funeral or all kinds of social gatherings, because this will help us to reduce the prevalence of addiction in Ghana. Second, also attend to the streetism, the prevalence of streetism in Accra. As we all know, when you are driving, they are always around. And if you are not careful, they will snatch your phone. These are people in Circle and all other Zongo communities that we need a Zongo advocacy program. We need a Zongo advocacy or an initiative that will involve people that are being addicts into this program, and we provide them coping skills. We provide them therapy such as motivational interviewing, such as trauma-informed therapy, because some of these addicts are traumatic patients. They have been involved, or they have been engaged, or might have been abused when they were little, such as rape, such as child trafficking or child kidnapping. It's a whole lot that I can't even go deeper into, or even family divorce or separation and all of that. However, if we set up these initiatives in the Zongo communities, we would be helping them understand and cope or deal with their trauma differently from whatever that is already programmed in these communities. Number three, I would like the government to also invest heavily on research. As we know, as Ghanaians, research is very, very low in Ghana. Like, apart from university students conducting research, government does not really support or fund research. So we would want data backing alcohol or substance use disorder, so that we can have targeted initiatives in these communities. For example, Sunyani community, the Sunyani Zongo community is different from Accra Circle community. So what are the initiatives that we can use to actually curb this menace? However, it is only research data that can back up by us also going deeper into these communities, understanding their problems. This is a key mental health problem. So we need to understand their problems and meet their needs and also their wants. Lastly, I would also like to advocate for the mental health profession. Okay, a lot of university graduates have completed with the psychology degree, but do not know what to do with it. However, there are so many options in using your university psychology degree. You can become a clinical psychologist, a counseling psychologist, and a whole lot in the psychology discipline. So we need all hands on deck in us understanding exactly what is causing this menace in these communities, and having a lot more than, I'll say right now, Ghana has only about 700 clinical psychologists. And you can imagine the ratio of 26 million people to 600 or 700 psychologists in Ghana. So we would need more psychologists posted in all regions in Ghana, because this may not only be in Sunyani community, but in other areas like Boku. You can understand the war, the conflict that is currently going on. People, I would say, are using substance to cope. People by now are using very, very hard drugs to cope. So we need to also go far and beyond to really prevent alcohol or substance use disorder in Ghana.
Ophelia, briefly before we let go of you, now you've spoken, you've raised all of these concerns, and while we are calling on governments to put all of these measures in place, let's talk about rehabilitation or mechanisms to cope for healing. Do we have rehabilitation centers, or what are the best options available when it comes to treatment for substance abuse?
Yes, so in Ghana, there are rehabilitative services. Number one, here in Accra, I think there are about 2, and there are also other private rehabilitative services. But it's sad, the whole of the northern regions do not have a rehabilitative centers. In Bolga, I know there was one, but I cannot tell if it is still functioning. So because people have the fear of going to the psychiatric hospital like the Pantan, and then the Accra mental health hospital, which is the Asylum Down, people do not even want to hear about it. So this is also another area that the government needs to highly invest on. At the end of the day, if people are stigmatized, they won't even in the first place go and seek for help, because they know that when they come, even the health workers themselves will stigmatize them. So yes, indeed, your question is good, but in Ghana, even though the available rehabilitation centers are functioning, they are not functioning to its best. And as you, as a Ghanaian citizen, you know, even in the hospitals, for example, the Accra Psychiatry Hospital, if you go there, there are so many needs that are not being met. Hospital beds, a whole lot. I don't want to sound like I'm really embarrassing the government and all of that, but this has to be public. This has to be known so that something can be done about it. Medications sometimes are finished from the mental health, even the cheap clinics that are set around in the community. Sometimes medications are finished for 3 months, 6 months, and people will always relapse. You see, so at the end of the day, the psychologist is even overburdened, because where you started from, you have to go back again and even encourage this person, which we call the motivational therapy, encourage this person to start medications again. And we know the stigma attached to that. So it's a really sad thing. Yeah.
All right. Ophelia, thank you so much for speaking with us on this issue.
Yeah.
We hope that...
You're so welcome.
All right.
And then if there's time, can I explain what substance use disorder is?
We'll have to get back in touch with you next time and get further into the conversation, all right? Thank you so much, all right? So we've been speaking with Ophelia Azuri. She is clearly very passionate and knowledgeable in this space, you know, and I think we need more people like this, and we need to shine more light on this. It's a very difficult issue. You saw the footage of the people. They are literally helpless and struggling, and the question is why? How did we get here?
Yeah, we're sad. And per the analysis or the conversation with Ophelia, it looks like we have a long way to go. We have a lot on our hands to deal with, because if we don't even have adequate health facilities, enough drugs.
And this is Sunyani we are talking about. This is one of the chilled places in the country.
Yes.
This is one of the most stress-free places in the country.
And the Bono region happens to be Ghana's food basket. That's what they call them.
So imagine the more stressful places in the country, what that looks like.
It's sad. We really need to do better. And I hope that government hears our call, or the call for help, and come to the aid of the Psychological Association, as well as we take mental health very seriously in this country, because sometimes we don't talk about these conversations enough because of the stigma that is attached to it or comes with it. But we hope that you hear our cry and then come to the aid of the helpless.